Welcome back to AM Northwest. If the stress of the season has left you looking tired and run down, well, there are some easy ways to refresh for the holidays. Here to tell us how, we're happy to welcome back from Gorin Plastic Surgery Medspa, Dr. Aaron Gorin. Good to see you again.
Thank you so much.
You know, it seems that it's the end of year, tired. You know, the season, tired. But it doesn't have to be that way.
That's true.
Yeah.
There are a few different procedures that we can do with really minimal downtime and minimal investments. And essentially no recovery time. And these include things like Botox and dermal fillers, which are really good for a rejuvenating effect on the face.
Explain dermal fillers.
Well, dermal fillers are things like Restylane and Juvederm. Those are the two most common fillers that many people have heard of.
And where do you put those?
Those are used essentially mainly from anywhere from the corner of the eye down to the jowl area.
Okay.
So primarily things like around the smile lines, into the lips themselves, and into the jowls to kind of smooth things out.
So the kind of the crow's feet, the eyes, the squinting, and that line around the face, those will go away.
The eye area is sort of a transition. At the crow's feet is not really a filler. That's used for that area. We use Botox and Dysport to kind of smooth out those lines. Same for the frown lines, which are probably the most commonly performed cosmetic procedure in the country, is Botox right here in the frown lines.
Right.
Also in the forehead lines. But as far as the lower eyes, that's also filler, in particular Restylane, to kind of smooth out those the fine lines and the dark circles that are there.
And you also recommend people who do get surgical procedures also do the Botox and
oh, absolutely.
fillers.
I think one doesn't replace the other.
Right.
From a surgical standpoint, there's lots of things that we do on the face, but in particular for the eye region, I'm a big fan of doing upper lid surgery in combination with a brow lift, or at least to prevent the brows from coming down.
Tell us what we're seeing here. Wow, she looks great.
Yeah, this is a woman who you can see her on her pre-op photo on the left side. Her brows are relatively high, but she's got a lot of extra skin on the upper lids.
Right.
And so by doing a little skin removal on the upper lids called the upper blepharoplasty, that tends to rejuvenate the upper lid area. But the brow position sometimes can drop too low. In this case, we made sure the brow didn't do that by a small procedure to prevent that from happening. Though there are other procedures out there that if you don't include the brow lift, then you can get a situation the brows come down too far. So there's been a lot of talk in the media these days about Renee Zellweger.
Yeah, I was going to ask you, there's some people go too far.
You know, I've talked to people locally here that actually think she looks better now than she did previously. I kind of liked how she looked before.
I agree.
Clearly there's a difference in how she looks before and after. And for whatever she had done, the brows, in my opinion, are just too low.
Right.
And that might have been some Botox in the forehead that might have been given too much. Or she might have had a brow lift. So that is, she might have had an upper lid surgery without a brow lift procedure, which then dropped the brows too low. So it's hard to tell. My goal is to try to keep people rejuvenated without an obvious surgical appearance.
How does a patient know what treatments are right for her? Do you help?
Yeah, well, patients will come...
Or him.
Or him. Yeah, they'll come in
right.
for the complimentary consultation to our office, and I spend as much time as we need to go over all the different options, both surgical and non-surgical. And sometimes the best option is to do nothing.
Let's take a look at another before and after here. And tell us what we see.
So this is a case that I just found out online, which sort of describes what can happen if you do an upper lid surgery without a brow lift. So you see on the right side of the after, her brows are kind of low and she's almost like she's more stern looking.
Right.
And so what I try to do is prevent that by kind of keeping the brows in a better position along with the upper lid surgery. So this is what we're trying to avoid, and I think maybe this might have been what happened to Renee Zellweger, but it's hard to say.
All right, let's talk about, you've got some specials running in December, including on Botox and derma fillers.
Yeah, right now until the end of the year, we have Botox at $9 a unit, and then we have a BOGO-HO, which is a buy one, get one half off.
Yeah.
For all derma fillers, including Restylane, Juvederm, Artefill, which is more of a permanent filler, as well as Voluma, which can last up to 2 years.
How long does Botox and derma filler, how long does it last?
Well, Botox is about 3 to 4 months. But dermal fillers last anywhere between 6 months and up to 2 or 3 years.
You also have specials on cool sculpting.
Oh yeah, we have a whole menu of services for the rest of the year. Our lowest prices occur in December, and so that includes things like cool sculpting for permanent fat removal, non-surgical.
And can that be anywhere, like under your chin,
it can
your
be in most places on the body.
Okay.
Most commonly, though, tummy, waist, outer inner thighs.
Gotcha.
And then we have specials on other things like laser hair removal, oil therapy, and a variety of different services.
Very, very good. If folks want more information, Gorin Plastic Surgery and Medspa. The number is 503-692-7222. And we'll, of course, have a link on our website at katu.com. Good to see you.
Thank you so much.